Welcome back for day 2 of the NBN21 Leadership Summit. For those of you who don't know me, I'm Margaret McDonald, the Executive Director of the Nothing But Nets campaign at the UN Foundation. Today, we will dive deeper into the role that you can play and the actions you can take to end the injustice of malaria. You will be virtually transported to the malaria front lines in Uganda and Benin. You will hear an insider view of the political landscape in the United States following the 2020 elections and what that means for the malaria fight and global health overall. You will be trained by the Nothing But Nets team on how to be an effective advocate, whether you're signing a petition, making a phone call, or joining our Advocacy Day tomorrow for virtual meetings with your members of Congress. And Advocacy Day participants will have the opportunity to meet and practice with your group. You can check out today's detailed agenda at the event portal. To help get us in the mood for advocacy, in the chat we've just included a link to our petition that reminds members of Congress about the critical life-saving role that strong U.S. leadership plays in the fight against malaria. Please take 1 minute to sign the petition so that your elected officials know that this is important to you. Many of you helped spread the word yesterday on social media. Let's keep it going today. Let your followers know that you're committed to the fight to end malaria, and please make sure to tag Nothing But Nets and include hashtags NBN21, End Malaria, and On the Front Lines. Also, please continue to engage and ask questions in the chat and Q&A feature. It's going to be a great day, so let's go ahead and get started. Now we're going to turn and bring a spotlight on the U.S. President's Malaria Initiative, or PMI, an interagency initiative led by the U.S. Agency for International Development, known as USAID, and implemented with the U.S. Centers for Disease Control and Prevention, also known as CDC. Since its founding 15 years ago, PMI has been one of the main drivers behind the incredible progress against malaria. As you know, 7.6 million lives have been saved and 1.5 billion infections have been averted over the last 2 decades. Thanks to the generosity of the U.S. government and the American people, PMI has invested $8 billion in nets, sprays, tests, and medicines, as well as heroic health workers in clinics and communities. PMI now works in 27 countries in Southeast Asia and across Africa, and every year protects more than 700 million people at risk of malaria. With that, I'd like to show you this short video about PMI's 15 years of transformative impact. That's a great overview of PMI's 15 years of transformative impact, and I love the driving beat, reminding us this is not a sprint, but a marathon. It's now my pleasure to introduce you to Dr. Raj Panjabi. He was appointed by President Joe Biden to lead the U.S. President's Malaria Initiative in February 2021. Born in Liberia, Dr. Panjabi settled in the United States after fleeing civil war at age 9. He previously served as a professor of Harvard Medical School and as CEO of Last Mile Health, an award-winning nonprofit he founded in 2007 to deliver life-saving care to the world's most remote places. Time named him one of the 100 most influential people in the world, and he won a $1 million TED Prize in 2017. Dr. Panjabi was trained in medicine and public health at the University of North Carolina, Johns Hopkins University, and Harvard Medical School. We're thrilled that he's now at the helm of PMI. So now over to Raj.
Margaret, thank you for the warm introduction. Pandemics are global, but their impact is personal. When I first contracted malaria as an infant, my mother was worried sick. We lived in Liberia, where, as is still the case in many countries across Africa, if you didn't know someone who died from malaria, you knew someone who has suffered from it. After several days of vomiting, fever, and chills, I was taken by my mother to a nearby doctor. I was treated. I survived. But for too many children and their families, this is simply not the case. Today, millions of people remain out of reach of the medicines, bed nets, and the health workers that they need to protect their lives. Today, over 200 million still fall sick with malaria around the world. Today, 4 decades after I survived malaria, a child still dies every 2 minutes from this disease, a disease we know how to prevent and treat. Illness is universal. Healthcare is not. This is one of the greatest crises of our generation. I've learned in my life we are not defined by the crises we face, but by how we respond to them. A year ago, while caring for patients in rural Africa, I saw the relief on the faces of parents whose children had been dying from malaria and who survived after being treated by medicines and health workers, supported by programs that the US President's Malaria Initiative has helped build. Launched in 2005, the President's Malaria Initiative, which I'm privileged to serve and lead, is one of the most effective and efficient development programs in history. In its first 15 years, the President's Malaria Initiative has invested nearly $8 billion in hundreds of millions of mosquito-killing bed nets and sprays, life-saving tests and medicines, and heroic health workers in clinics and communities. Together with our partners, the President's Malaria Initiative has helped save 7.6 million lives and avert 1.5 billion infections. Now, this is something all of us in the malaria community should feel proud of. But in this past year, we have faced a new unprecedented crisis that has threatened to reverse these gains. COVID-19 has threatened this progress. I've been inspired by how the global malaria community continues to respond. Malaria campaigns that provide people with mosquito nets, ensure homes are sprayed with insecticides, and distribute preventive medicines for children, although initially delayed, have been adapted and sustained. And the health workers who carry out these preventative campaigns have been trained and equipped to provide these services safely. Now, let me be clear. While the malaria community has remained resilient, the progress we've made is under threat. COVID-19 is still straining health workers and clinics, and that is threatening to disrupt access to malaria testing and treatment. New mutant parasites and mosquitoes are becoming resistant to medicines and insecticides. And now unpredictable rains due to climate change are creating new standing water pools where malaria-carrying mosquitoes can breed, increasing the possibility that this disease could impact millions more who may have never been exposed to it. If we are to end malaria within our generation, we need bold action. And we need bold action in 3 specific areas. First, we must reach the unreached. Hundreds of thousands of children, especially in the world's most remote communities, die from malaria every year without receiving a single test or medicine. That is unacceptable. Too many pregnant women still go without the preventative treatment they need to protect their babies from malaria, leading to unnecessary stillbirths. That is unacceptable. We must target the regions with the highest burden of malaria, but the lowest coverage of bed nets, preventative treatment, tests, and medicines. And this has to include reaching the most remote communities. Simply, we must put the last mile first. Second thing we have to do is to make health systems safer and better. Too many nurses, midwives, community health workers, and others who are on the front lines of delivering malaria services still struggle without sufficient training, equipment, and even fair pay. In the face of COVID-19, some have gone without the masks, gloves, and gowns to protect themselves. We must invest more in the armies of health workers and the networks of clinics and laboratories they run. Doing so is not simply going to help us in the fight against malaria, but it's also going to help us respond to other threats, including COVID-19 and the pathogen that will cause the next pandemic. And the third thing we need to do is to end malaria faster. In this century, together, we've already helped eliminate malaria in 21 countries. But too many countries are still far from their goal of eliminating malaria. We need to bring countries closer to ending malaria. And to do that, we must leverage new data systems, technologies, and tools. The science, my friends, shows it can be done, and we should do it. I was recently asked, why should we care about malaria now? I think it has to do with a four-letter word called hope. More people have died from infectious diseases than any other phenomenon in history. Humans have been in an existential fight with pathogens since the dawn of humanity. We are now at a turning point in this fight, in our fight against malaria. Losing this war against this disease will lead to despair in our fight against other pandemics. We all know this doesn't have to be the case. We must end malaria within our generation. And if we do that, then we create hope in the fight against future pandemics as well. And that hope is worth fighting for.
Hi, my name is Wendy. I'm the Grassroots Advocacy Officer at the United Nations Foundation Nothing But Nets campaign. And in this session, we're going to talk about the vast continent of Africa and how programs on the ground are innovating to defeat malaria. Africa continues to carry the lion's share of global malaria burden. In 2019, the continent was home to 94% of all malaria cases and deaths. Incredible progress has been made on the continent to reduce cases and deaths, thanks to in-country leadership, significant investment from partners such as the Bill and Melinda Gates Foundation, the Global Fund, PMI, WHO, and UN agencies. Life-saving tools created by private sector partners from nets to treatment, and the tireless energy of the heroes fighting malaria on the front lines. However, that progress has stagnated due to challenges such as insecticide resistance, insufficient resources, reduced commitments, and now COVID-19. Now more than ever, innovation is required to battle one of the oldest and deadliest diseases known to humankind. People in programs on the malaria front lines in countries such as Uganda and Benin are proving that while malaria parasite is smart, we are smarter. First stop, Uganda, where one of the most vulnerable populations to malaria is fighting back. Uganda ranks 8th in number of malaria infections in sub-Saharan Africa and has some of the highest reported malaria transmission rates in the world. Dr. Jimmy Opaigo, the head of the Malaria Control Program at the Ministry of Health in Uganda, talks about how his country is working to change that.
On behalf of the Ugandan people, we keep extending our appreciation to the American people for the support we keep receiving over the years to fight malaria. The funding and technical support we have received from the President's Malaria Initiative, of course rooted from the American people, has seen us reduce malaria prevalence in Uganda from 42% in 2009 to 19% in 2014, and now a single digit 9% in 2019. We are now positioned to go to less than 5% and move towards elimination. So it's very promising, is a resource well used and very much appreciated. We know this support from the American people comes not only through the President's Malaria Initiative, but also CDC, Department of Defense, National Institute of Health, and a very substantive one through the Global Fund. When you go to any hospital, and this hospital we are looking at, you can see the support we have received in terms of commodities, supplies, life-saving action which restore life and health of those the children who would have otherwise lost. Now, with the turn of COVID, we expected the worst. As COVID disrupted the health system, disrupted livelihoods, disrupted public transport, and so people could not seek care. It even scared people to touch anybody with fever, which malaria also presents with. Fortunately, we worked very quickly with our partners, especially the President's Malaria Initiative, to ensure that we continue services, essential services, the challenges notwithstanding. To make it possible for our community health workers to operate even within COVID, they were provided quick training. They were provided PPE to protect themselves, to enable our field teams deliver the much needed residual indoor spraying within COVID, because there has been a deliberate focus on saving lives, deliberate focus on children, deliberate focus on mothers, the most vulnerable people. But just not only saving lives, but also building competence among communities through malaria smart schools. In the malaria smart schools, we are focusing on building a malaria prevention culture among the children, but also building the children to be change agents to their homes so that they drive change sustainably and impactfully in our communities. As we continue in the going years, the Ugandan people do not take all this support for granted. And we look forward to continued support to save lives, but we can only demonstrate our appreciation by using every dollar properly and accounting for every penny. And we can further demonstrate our appreciations by saying, God bless America. As I end, I would like you to take a look at what actually happens in our hospitals.
I'm Dr. Tumsime Fred Katakanya. I'm medical superintendent at Antondo Hospital. This is how we handle our patients for clients. As soon as the patient enters, they are screened for COVID-19. At OPD, as you can see here, this is where we do triage. Those who are very sick, immediate patients, they are handed over to the doctors and clinicians for immediate interventions. From this table where the triage is done. Very sick patient, taken to emergency room. These are the patients. You can see this is doctor's room. And we have our emergency rooms. This is our emergency room. Though it is small, but this is our emergency room. You can see these are the very sick patients who cannot wait. This is our store for our medicines. You can see the compartment for antimalarials. This is our dispensing window. These are the staffs. They are serving patients. Yes. So this is our laboratory department. In the laboratory department, so far we have some statistics. In 2015, our testing rate was 68%. As of 2020, the testing rate is now 99%. When you look at in 2015, the positive cases of malaria were at 28%. In 2020, the positive cases of malaria were at 30%. This is so far the figure we have. This is our antenatal care clinic for mothers who are pregnant. In 2015, malaria in pregnancy was 1,257. And in 2020, we had 48 mothers who had malaria. Yeah, this is the entry to pediatric ward and female wing. In this department, we have two sides. One is for children, for pediatric. Another one is for female. Any patient that comes, after admitting this patient, we provide this, each bed is provided with a mosquito net to protect this patient from malaria infection. So any patient is encouraged to sleep under mosquito net, and the staff take the responsibility and initiative to make sure that this patient sleeps under mosquito net. I'd like to appreciate in a special way the Antonde General Hospital staff for the commitment they have always exhibited and the determination they have portrayed they have put in to make sure they reduce the cases of malaria in our district, especially among the pregnant mothers. And also, I want to encourage the staffs to always teach, sensitize the public and the mothers who come to antenatal clinic the benefits and advantages of sleeping under mosquito nets. That it protects them and it protects them from losing the pregnancies as well, because malaria is one of the causes of the miscarriages and abortion. So I encourage the staff to always remind and sensitize the public and the mothers to always sleep under mosquito nets. Yes, and with those words, members, I thank you so much for their commitment. I thank you so much for the service rendered to the community. May God bless you so much.
Thank you to Dr. Jimmy and the PMI team in Uganda for giving that first-hand look into what's happening on the malaria front lines. The efforts of PMI and other partners like Global Fund are critical to saving lives. This map represents cases in Uganda for 2019. Children under 5 years of age continue to represent a disproportionately high share of the malaria burden. In 2019, 274,000 children around the world died from malaria, making up to 67% of all malaria deaths. In Uganda, 20 to 30% of all pediatric admissions to hospitals are due to malaria and severe anemia, which is often due to untreated malaria and continues to plague health centers across the country.
You're welcome to Walioba, a malaria smart school.
Ugandan school children are fighting to change that. At the Walioba Primary School, a malaria smart school, as you just heard, a student named Ayaturn mentioned, students are battling malaria head-on through song, dance, and art. This school is located in western Uganda and is supported by the President's Malaria Initiative MAPD project. In every classroom, you'll find a malaria corner filled with student-drawn information about the disease, causes, and prevention methods. This is Ayaturn Admani, the student you heard from earlier, and he takes us through one of the materials in his classroom's malaria corner.
How enough is mosquito spray? Malaria.
The school's headmaster, Biona Ntairaho, has worked as the district's music instructor for nearly 20 years and specializes in music to foster learning. In the background, you can hear one of the performances Biona helped produce. As part of the project, students received a free bed net, which can protect them for up to 3 years. Armed with nets and knowledge, these students act as behavior change agents in their homes and wider communities. And that's what the PMI MAPD project was meant to do. Take the students' malaria education beyond just the classroom and build a brighter future for Uganda's children. The benefits of ending malaria extend beyond just good health. Reducing malaria enables children to attend school regularly and learn more effectively. It can significantly improve their school performance and later wage earning capacity. Ending malaria would have a significant impact on girls and women. Women and school-age girls are often the caretakers for their sick loved ones. Without the burden of malaria, they can focus on other activities like completing school, entering and remaining in the workforce, and participating in public decision-making. Club advisor Rebecca Ija Okole works with participants alongside Biona to compose unique songs, poems, and dances designed to educate their peers and community members about the dangers of malaria. Watch as students perform one for their community.
The massless female Anopheles mosquito that bites people using their sharp proboscis, all the way from bushy areas, broken bottles, and stagnant water, sucking blood from infected and uninfected persons with the aim of making its eggs to mature. Every day, innocent people are infected with malaria, having fever, headache, vomiting, and joint pain. Some are admitted in hospitals, while others lose their lives due to malaria. This is our advice to you all. Sleep under treated mosquito nets. Clear the bush around the area of residence. Dispose of containers where mosquitoes can breed. Spraying with insecticides. All this to prevent the increasing spread of malaria. For God and my country.
The club's 40 student members, ranging in age from 6 to 15, have performed at school assemblies, parent meetings, and the local market. But they're not stopping there. The project utilizes a peer-to-peer approach where Malaria Smart Schools help other nearby schools set up their own health clubs. Through the Malaria Smart School model, these children are empowered to take the fight against malaria into their own hands. So watch out, malaria. These kids have nets and they know how to use them. With smart and creative, passionate champions like these, we can be the generation to end malaria. Now we're headed to Benin, where a new innovative bed net distribution strategy is addressing the challenges incurred by COVID-19 head-on. Benin is faced with one of the highest burdens of malaria in the world. Their population of just over 12 million people faces 2 million malaria cases a year. On this tour, you'll hear music produced by Angelique Kidjo, a Beninese American, Grammy Award singer-songwriter, UNICEF Goodwill Ambassador, and an activist who raises her voice to help end malaria. We all saw how COVID-19 challenged health systems in 2020, and this was no exception in Benin. Surveys from the Global Fund supported programs across 106 countries showed COVID-19 led to widespread disruptions, impacting approximately 3/4 of malaria programs. Delays in mosquito net distribution put vulnerable populations at risk and could lead to a significant spike in malaria cases and deaths. And as we all witnessed, some of the most vulnerable people to disease and death are health workers themselves. Testing and treatment for malaria depends critically on their availability, and COVID-19 means that they may be unable to travel, are sick themselves, or don't have the proper PPE to protect themselves. These hurdles didn't stop the government of Benin or supporting partners like the Global Fund and PMI from adapting their bed net distribution in order to protect the most vulnerable. As you can see in this photo, a normal bed net distribution requires a mass gathering at a fixed point in the community. The threat of COVID-19 meant that this strategy had to shift. For the first time, community health workers in Benin went door to door to distribute more than 8 million mosquito nets across the country. About 5,500 community workers completed this in just 20 days. Can we just stop and think about how amazing that is? 8 million mosquito nets in just 20 days. That meant that almost the entire population of Benin is now protected with the delivery of these nets. This was done in close collaboration with Benin's National Malaria Control Program. But door-to-door delivery of bed nets are not the only innovation in Benin. we're going to show you a video of how the government of Benin is tracking bednet distribution in partnership with the Bill and Melinda Gates Foundation, Catholic Relief Services, and the Global Fund.
Since the year 2000, deaths from malaria have been reduced by more than half. One of the reasons why is the use of insecticide-treated bed nets, which protect people from mosquito bites at night. But more needs to be done to ensure everyone at risk of malaria has access to them. In Benin, a new innovative bed net distribution program promises to improve bed net coverage, reduce malaria transmission, and save lives.
Chaque année au Bénin, nous avons environ, dans la population générale, on a environ 2 millions de cas de lutte qui sont mis en place au Bénin. Mais cependant, les cas augmentent. On a environ 3500 décès et chez les enfants, ce chiffre va tourner autour de 2500 décès par année. Donc dans cette lutte-là, la moustiquaire imprégnée joue un rôle capital. Le pays fait une campagne de distribution de masse. Ils savent déjà que tous les 3 ans,
the idea is to have every person in Benin have access to and sleep under an insecticide-treated net. It repels the mosquitoes, but also kills them if they land on the net. You diminish the population and the lifespan of the mosquitoes. Therefore, you diminish the transmission burden as well. In the past, these massive bednet campaigns had paper-based systems to register households and eventually distribute these nets. The paper-based systems are actually very expensive to conduct and are often far from accurate. But now, many of the activities that formerly occurred on paper are now done in a digital platform through a smartphone.
Les volontaires sont ceux-là qui sont sur le terrain, les équipes déployées sur le terrain pour faire le recensement. Donc on a les informations telles que la taille des ménages, le sexe, l'âge des enfants, les femmes enceintes.
The household will receive this QR code-enabled coupon that they take to a distribution site. The coupon is scanned by the health worker, and it immediately indicates the number of nets that they should be receiving. All the information goes into a database in the cloud, and it presents an immediate way of actually identifying problems or issues. Supervisors then can go to those spots where they're seeing difficulties and try to address them right away. It really improves the efficiency of the entire process. Digitized mass bednet distribution saves more lives, it saves more money, and it saves more time.
Le programme de digitalisation nous permet pour avoir une bonne couverture des ménages qui nous permettront quand même de réduire les cas du paludisme et pourquoi pas, comme d'autres pays également, aller à l'élimination.
And this initiative will make a difference not only for malaria but for other health campaigns. It's really exciting to see what this is doing now and what it really could do in Benin in the future.
Benin's commitment to reaching the last mile is a guidepost to how other programs can ensure a bednet reaches the hands of everyone who needs one. In a year filled with so many challenges, 5,500 community health workers in Benin covered thousands of miles to ensure no one in their country had to worry about the threat of a mosquito bite. We think that's something worth celebrating. Now, I would like to take the time to thank one of our sponsors for this event, SC Johnson.
Thank you, Wendy, for that inspiring tour of the malaria front lines in Uganda and Benin. As a mom of 3 young kids, I was particularly moved to hear about Lantonde's hospital's success in reducing malaria among pregnant women. The strength and perseverance of those working on the malaria front lines is truly phenomenal. I do want to give those who have learned about this program and are giving us shout outs on social media thanks. Jesse Elliott, Dr. Adriano Schneider. We even heard from Dr. Tedros and Dr. Raj Panjabi. So if they have time to promote us on social media, so do you. So please join us and make sure to tag Nothing But Nets and include the right hashtags. So as Wendy mentioned, we're really grateful to SC Johnson for their sponsorship of this year's summit and for our burgeoning partnership overall. SC Johnson is a family company dedicated to innovative, high-quality products, excellence in the workplace, and a long-term commitment to the environment and the communities in which it operates. Based in the United States, this company is one of the world's leading manufacturers of products for household cleaning, home storage, and pest control, such as well-known brands like Glade, Off, Windex, and Ziploc. The 135-year-old company employs 13,000 people globally and sells products in virtually every country around the world. SC Johnson has long been committed to making life better for families around the world. Since 1937, they've given 5% of all pre-tax profits to charities. Their base of the pyramid group, also known as BOP, is focused on providing opportunities for a better quality of life for the 4 billion people living at the base of the world's economic pyramid. One of BOP's areas of focus is catalyzing the prevention of malaria and other mosquito-borne diseases by delivering affordable interventions that are tailored to the realities and challenges of communities. Examples include developing spatial repellents for migrant workers in Southeast Asia, increasing access to health services in Rwanda, and contributing disinfectant kits to protect health facilities in Borno State, Nigeria in light of COVID-19, a project we've been honored to work with them on. SC Johnson is truly a company committed to reaching the last mile in the fight against malaria. With that, we'd like to show you this message from SC Johnson.
At SC Johnson, we've been committed to making life better for families around the world for more than 130 years. As the leading global manufacturer of household pest control products, and with one of the largest private entomology centers in the world, SC Johnson is uniquely positioned to help fight mosquito-borne disease. Our base of pyramid group is focused on public health, specifically delivering low-cost, accessible mosquito-borne disease prevention methods that is tailored to the world's poorest 4 billion people. The group works closely with the communities where mosquito-borne diseases hit the hardest. Ultimately, these are the connections that help SC Johnson create actionable solutions that best fit into families' lives.
Communities, are different all around the world. You can't just go visit one community and then assume that everybody lives the same way. But some commonalities are that they can't always afford the tools that they need, and they're often located in remote, difficult to reach areas. So our goal at SC Johnson is to develop affordable products that work really well.
We took this work to a higher level in 2018 when we formalized a partnership with the Rwanda Ministry of Health and Society for Family Health Rwanda to build community health posts to address public health issues like malaria, HIV/AIDS, family planning, access to clean water, and nutrition. Together, we built 56 health posts across Rwanda, creating access to healthcare services, malaria education, and prevention interventions for more than 200,000 people.
Some people were walking 2-3 hours to access the healthcare that they needed, and now we've been able to provide access to healthcare within 30 minutes walking.
To tackle malaria on the front lines, we are currently partnering with the Bill and Melinda Gates Foundation, the University of Notre Dame, and Unitaid on a 5-year research project to develop Mosquito Shield, a spatial repellent product, advance mosquito-borne disease research, and test the product around the world where malaria is endemic.
There are several tools that are available that work, but even with that, there's still residual malaria transmission. And so there needs to be new tools developed in the public health space that address those occasions when people are getting malaria.
Studies have shown that using spatial repellents can reduce the frequency of mosquito bites, which may lessen new malaria occurrences. A vital public health need considering that nearly half of the world's population, or 3.4 billion people, are at risk for malaria. We have also partnered with the United Nations Foundation and Mentor Initiative to help tackle malaria during the COVID-19 pandemic. Together, we designed the first ever comprehensive and standardized disinfection kit with non-worded pictogram instructions for health facilities and hospitals in low-resource settings in Borno, Nigeria.
We looked at what are the products we have across our portfolio what fits into the setting. Should we send this product or this product? And we built these disinfection kits, and we've worked with both partners to plan what's the areas that are most in need. And after we got them shipped, the Mentor Initiative has been organizing the distribution to ensure that the healthcare workers are able to stay safe and that all these communities that are at risk can still access the healthcare that they need.
By making malaria education and mosquito repellent products available at scale and working to find interventions that are tailored to the communities we serve, we are helping more people to protect themselves from mosquito bites and to reduce mosquito-borne diseases. SC Johnson is a company at work for a healthier world, and our mission is to help save lives and increase access to prevention methods for the world's poorest by applying our core competencies in science, innovation, and partnerships to address some of the world's most pressing public health issues.
Thanks again to SC Johnson for that insightful overview of their work and for the partnership. As mentioned, U.S. investments in malaria through UN partners, PMI, and the Global Fund have been huge drivers of progress over the last 2 decades. In order to overcome current challenges from insecticide resistance and drug resistance to COVID-19, we need continued and even stepped up U.S. leadership and funding. This is why, for this upcoming fiscal year, we are asking U.S. Congress for level funding for the Global Fund and an increase for the President's Malaria Initiative so that they can rise to these challenges and ensure that we continue making progress to end malaria for good. If you haven't already, please do sign the petition in the chat. Fortunately, due to the Global Fund and PMI's life-saving track record and demonstrated strong return on investment, and with thanks to your effective advocacy efforts, these programs have enjoyed strong bipartisan support. Both Global Fund and PMI were initiated while George W. Bush was president, were strengthened under President Obama, and while threatened to be cut by President Trump's administration, were protected and even increased thanks to strong leadership in both the House and the Senate and among both Republicans and Democrats. This is why your advocacy is so important. When you share your passion about this cause and the life-saving work of these programs, your elected officials are inspired to champion them as well. With that, I would like to show you messages from the co-chairs of the Senate Malaria and Neglected Tropical Disease Caucuses, Senator Coons, Democrat of Delaware, and Senator Wicker, a Republican from Mississippi. As Senator Coons and Senator Wicker have often noted, they disagree on a wide range of topics, but are united when it comes to understanding that no one should die from a preventable, treatable disease like malaria. Following later sessions, we'll hear from Senator Marco Rubio of Florida, Representative Adam Smith of Washington, Representative Jimmy Panetta of California, Representative Tom Cole of Oklahoma, Representative Betty McCollum of Minnesota, Representative Brian Fitzpatrick of Pennsylvania, and my Congressman, Representative Jamie Raskin of Maryland. As you can see, there's a wide range of support for these programs, and there's plenty of room and need for more congressional champions, which is why we advocate. So now, we're going to hear from Senator Coons and Wicker.
Hello, I'm Senator Roger Wicker from Mississippi. Thank you for continuing the fight against malaria. Even today, malaria remains a threat around the world. But the United States is leading the global community in working to eliminate this disease. 10 years ago, Senator Coons and I started the Senate Malaria and Neglected Tropical Disease Caucus to raise awareness and support on both sides of the aisle to combat a disease that claims so many lives every year. Over the years, millions around the world have been protected through U.S. leadership and your commitment. As we work to end this disease for good, your efforts make a difference. Thank you for staying the course, even in the midst of COVID-19, to defeat malaria.
I am Senator Chris Coons, and it's my honor to join you in this Nothing But Nets event to continue our work to eradicate malaria around the world, work that is even more critical in the face of a global pandemic. I'm proud to lead the Senate Malaria and Neglected Tropical Disease Caucus along with my friend Senator Roger Wicker. Because of continued bipartisan investments, the U.S. has aided in saving over 7 million lives, averting over 1.5 billion cases of malaria and reducing malaria-related deaths by 60%. I look forward to continuing our progress, and with your efforts, look forward to a world where malaria will be a part of the past. Thank you.
Hello, my name is Jessie Elliott, and I'm a Nothing But Nets champion from Seattle, Washington. I first got involved in advocacy with Nothing But Nets about 4 years ago when my wife introduced me to the campaign, and I've been a champion ever since. Personally, I actually fly as an airline pilot for an airline that flies to international destinations, and so we do fly to malaria endemic countries, but we are offered the free resources to prevent ourselves from getting sick. And I realized how unfair it was that I have these free resources when the countries I may be visiting, many of the people don't have those same free resources. So today, we're focused on what we as champions are uniquely situated to do, which is to meet with our members of Congress and remind them the importance of eliminating one of history's deadliest diseases. We all know that it's been a challenging year, and a lot's changed since we were in DC last year together. We continue to face a global pandemic. We went through a pretty rough election, and so there's a lot to sort out. So this next conversation is intended just to help us get through that. As an advocate with Nothing But Nets, I'm really thankful that we have Peter Yo, president of the Better World Campaign and senior vice president at the United Nations Foundation. And we also have Crystal Lander, who is the executive director of global affairs at Pathfinder International. And they're going to help us untangle what's happened this past year to help us better understand the context and the atmosphere in Washington, D.C. as we step into our meetings tomorrow. As president of the Better World Campaign, Peter Yo leads the campaign's strategic engagement with Congress and the administration to promote a strong U.S.-UN relationship. Mr. Yo also serves as the senior vice president at the United Nations Foundation, and he joined the Better World Campaign in 2009, having served in senior roles at Capitol Hill and in the State Department. Prior to his time at the United Nations Foundation, Mr. Yo served for 10 years as Deputy Staff Director at the House Foreign Affairs Committee. Crystal Lander is an experienced senior policy and development expert, both in the United States and globally. Ms. Lander was recently announced as the new Executive Director of Global Affairs, leading the design and delivery of advocacy campaigns, overseeing advocacy strategies, and serving as an ambassador for the organization globally. Prior to this role, Ms. Lander developed and led the advocacy team at Living Goods, where she managed the organization's engagement on global health policy. She and her team have worked to drive lasting and systemic impact that will enable every family to access quality health care in the community in which they live. Ms. Lander also developed and led the advocacy unit at Management Sciences for Health for more than 7 years, where she successfully managed the organization's engagement on global policy in the United States and in more than 30 countries. Please help me welcome Peter Yo and Crystal Lander.
Welcome to this year's annual Washington Insider Fireside Chat at the Nothing But Nuts Summit. The last time I think I was wearing a jacket was at last year's Nothing But Nuts Summit, and it has been quite a year. It's been a year of working from home and having our kids being educated at home, worrying about our health, the health of our families, the health of our communities, waiting for a vaccine, waiting for a solution. And it's all the more testament to the fact that you're here today. You're here, that you advocating and learning about malaria despite all of that. So thank you very much. Really appreciate it. This is a new time in Washington as well. We have a new administration, a new Congress, and I think it's important as well to reflect on where we were for the past 4 years. During the Trump administration, there were significant efforts made to cut foreign affairs spending, cut American support for malaria prevention and treatment. And it was because of you. It was because of advocates around the country that these significant cuts were beaten back. When members of Congress heard from you, they heard from constituents around the country that our investments in malaria are consistent with American interests. Obviously, the new administration has a very different perspective, is reasserting American leadership on the global stage. And President Biden, on his first day in office, canceled America's withdrawal from the World Health Organization. We've seen the administration support increased funding for international COVID-19 response. And he's assembled a group of experts in his administration who are working to reassert American leadership and ensure that there's a real partnership with the rest of the world to tackle COVID-19 and to tackle malaria. And it's exciting to see. None of this will get done, of course, without bipartisan leadership from the Hill and from you all. And so it's exciting to see. To help us figure out what's happening in Washington, we're really lucky to have with us Crystal Lander, who is Executive Director of Global Affairs at Pathfinder International, which works to promote better global health outcomes around the world and is an important ally of Nothing But Nets. So welcome, Crystal. We appreciate your participation today. Crystal has a long career in advocacy at other organizations that work to promote better global health and development outcomes. She's a graduate of University of Michigan and got her master's in public health at Tulane University. So, Crystal, if you don't mind, I'm going to throw a few questions at you. Have a little dialogue about what's happening here in Washington. Now, President Biden has promised to work across the aisle to get things done. And global health has always been an area where Republicans and Democrats could work together to accomplish better things for our world and really try to help achieve the Sustainable Development Goals. But there's been some fracturing over the past 4 years. So do you still think there's room for common ground here in DC on global health?
First, thank you, Peter. And I'm really excited to be here. I am at my heart an advocate. And so I love that you have so many who are online now who are here to basically lend their voices to this topic. And I will start with the nice thing about global health is it is bipartisan. No matter what is going on the news, it was nice to walk the halls of Congress back in the day when we could walk those halls and talk to offices on both sides of the aisle about global health. There really was this feeling that this was our common ground. I think one thing that brings everyone together is they understand these issues and people have family, they have, connections around the world, and more as global as we are, you have those opportunities to make those connections. Even now, when it's a close number in Congress, I'm really still excited and think that we can make things happen. I think sometimes that doesn't lead the news, so you don't necessarily hear about those things, but know that these things are happening. And like you said, advocates from around the country calling their members of Congress and saying, this is important to me. Even if I'm living in Iowa or I'm living in Texas, these things are important to me. And I think members of Congress hear from people all the time on these issues.
And did you get the sense that when members of Congress are hearing from their constituents that they are uniquely positioned to make some progress on global health issues? Because there's so many issues that divide Americans. But does global health really divide members of Congress?
It's funny you said that, because when you're in congressional offices and you're talking to members or you're talking to their staff, many times they'll say, I got this call from our office. They know about malaria, or they're asking me about this global health issue. And I think they're surprised. They're like, people all over the country still care about these issues. Because at our heart, we know that Americans care. We jump in when there's emergency around the world because at our heart of hearts, that's who we are. So I think the surprise comes in that they're saying people are paying attention to this in the middle of the country or in a small town up north. That I think they're surprised by it. But I also think it resonates even more because they're saying, wow, they do care. They took the time to call me and say, this is important. And so all of a sudden, they realize that if one person calls, it's probably 100 people who felt that way. And so it really does matter. And I hear those conversations all the time about those things.
And we have some new players in the power dynamic as it relates to foreign affairs and malaria in Washington. We have Samantha Power, the new designate to be head of the U.S. Agency for International Development, which is the primary organization that implements American foreign assistance and global health programs, including malaria. And then we have on the Hill, we have Gregory Meeks, the new chairman of the House Foreign Affairs Committee, and Barbara Lee, a longtime champion who is now chair of the State Foreign Ops Subcommittee, which gives away all the money for these important programs. So talk to us a little bit about these new players and what kind of implications might it have for foreign affairs generally?
Yeah, absolutely. So we know Barbara Lee, she's tried and true. She's from California. So to some degree, we expect great things out of her. So we're saying, oh, we know she's going to be there. She's tried and true. But I love the fact that Samantha Powers, who is the nominee, as you said, because she has a different background. And I think she got into kind of even this global field by just being someone who was at home or was at college, I think at the time, where she said she was moved by stories that she saw on the news. So just a regular person who said, wait a second, these images are powerful, and went on to be editor and a news, and as a young person running around the world, basically saying, you know what, I can make a difference. Telling my stories, writing, being a reporter, this will help figure out where the rest of things need to be elevated in the world. She was really like that advocate on the ground. And I think she thought of herself as that really young, as calling and just saying, hey, we need to pay attention to this. And I think one of the things, I read her story, her biography, and was looking through some of those things, and it just really resonated with me as an advocate. It was like, hey, my voice does matter. And more than anything else, we know these voices of people all over this country matter on these issues. And to see her now be in place for this really important job where she gets to bring her advocate voice and say, you know what, I want to speak up for the little people who may not be able to tell their stories. And I want to pay attention, particularly around human rights issues, which I think is amazing. And then you have Gregory Meeks, who, again, was like an average person, everyday person. This wasn't someone who necessarily grew up saying they wanted to be a member of Congress. And so now he's in such an important position to really make impact. It's incredibly exciting. And I think more than anything else, I am looking forward to all that the new administration and these new power players in Washington can really do to move global health forward. Hopefully we get to some vaccines for multiple issues, including malaria, and that we will make some major impacts over the next few years.
Well, it's interesting what you say about Samantha Power. One other element that's important to understand about her is that during her career and during her tenure as representing us at the United Nations, she was often focused on preventing conflict or dealing with conflicts that were ongoing. Part of her role now at the Agency for International Development will be to deal with the after effects. How do you reconstruct countries in partnership with local communities and the national government that have been affected by conflict, that are trying to emerge from years and decades of civil strife that has really undermined the infrastructure in countries? So it's interesting. She'll have the full range of experiences in working with countries now that have gone through these major events. Barbara Lee started as a congressional staffer, and now she's made good and is now one of the most powerful members of Congress.
And so passionate about it. Her passion is one of my favorite things to hear her speak, because she loves what she does, and that's great.
She's also committed to bipartisanship. Barbara Lee is very progressive, and people view her as a super progressive member of Congress from the Bay Area and San Francisco. All true. She's also uniquely able to work with Republicans, and the PEPFAR bills that were saved millions of lives would not have happened without Barbara Lee's leadership and her willingness to work with Republicans on common ground. So she's really a trooper. Now, one of the questions we get a lot as advocates is, how do you convince members of Congress to care about malaria when we're dealing with COVID? Not everybody's vaccinated. Our families and schools aren't fully protected yet. Why should we be investing in international issues like malaria or COVID when we have so many needs here at home? How do you respond to that?
And I think COVID actually explained why, is because the world is pretty intertwined, and we appreciate that. And it's great because we get friends and talk to people all over the world and connection. But it also means that no one is safe until we're all safe. No one is secure. No one's child is secure and vaccinated until we all are vaccinated. And I think particularly with malaria, so much progress has been made that I think members of Congress, their staff, who've been able to maybe take trips to visit some of these places around the world and see firsthand all of the support, thanks to the US government, that has happened to change families' lives directly. I do think with everything happening with COVID, they don't want to lose that momentum. We don't want to lose that momentum. It's important that we have all boats continue to rise, and we can do it. It's very inexpensive to prevent malaria. It's far more expensive to treat it on the other side. So I think that when we really talk about the investment, long-term investments we've made to global health, I think even with everything going on with COVID, members of Congress get it. And again, activists need to call and say, this is still important to us. We get that, but we can do two things at the same time. And I think that is a really important message. I think that when you talked about the bipartisanship, Barbara Lee, I think about that a lot. The Florida delegation, where Gregory Meeks comes from, they always make me laugh because they're like, we're great friends. We may disagree, but we're great friends. We talk it out with one another. And I love that. And I think that, again, it doesn't necessarily get, caught on the news, but those things are happening and they do work together. And I think things like global health and things like malaria, which can happen anywhere, I think are those issues that they really can bond together over and say, how do we do this together?
Crystal, you're making an important point, which is that in the past, we made the argument that what happens abroad matters to what happens here in our country. We have seen with COVID that, in fact, what happens in other countries, global health development, absolutely matters to the health and safety of our families and the economic well-being of our country. And I think the second point I'd make as well is that we still need to remember as we communicate with our members of Congress, foreign affairs spending is less than 1% of the total federal budget. And malaria spending is a small sliver of that total amount. So as we think about our budget challenges as a government, you can't balance the federal budget off of foreign affairs spending. You just can't. So what happens abroad matters here to us, and we're not the driving force between, we're not the force that is driving higher federal spending. It is other areas of the budget. So go after that.
Absolutely. And I think a lot of members of Congress really do get that. They get that it's such a small percentage, but it means so much. And even more, U.S. leadership is so important. U.S. speaking up on our values, and that our values means that we do believe that we have a lot to add. And being a leader doesn't always mean being in front. Being a leader means supporting side by side, sometimes behind the scenes. But that support for global health, we're good at it. We want to support other countries around the world. We know that these things are important. And we're really talented at addressing some of these key issues. And so I think our funding goes hand in hand with technical expertise and support to governments as they address issues like malaria at their home.
You're raising an important point, Crystal, which is that our investments in malaria are done in partnership with people around the world. This is not us coming to fix somebody else's malaria problem. This is a case where these governments, together with their local leaders and local communities, have determined that battling malaria in their countries is an important priority, and we're there to help. We're there to provide financial resources, additional expertise, and partnership. And we both have had the opportunity to travel in the Global South and to see these types of programs being implemented. And you can see how important it is people line up to get their bed nets because they want to save their families from malaria. And in a weird way, just like we see Americans lining up for our COVID-19 shots. And so there's a nice synergy there that we recognize these things that can save our lives, and we're willing to prioritize them. Crystal, the summit participants will be participating in a lot of HILT meetings. What are your top 3 tips for effectively communicating with congressional offices?
One is relax. It's going to be fine. They don't expect you to be experts in anything. They just want to hear from you. So I would say top 3 things. One is go in and relax, have a good time, introduce yourself, really be clear on why you're there and why this is important to you. The other thing is it's okay not to know all the answers. It's okay to say, I'll follow up with you on that. And it's a great way to get their email too. So that's always an easy thing. And then third is just be authentic. Just tell why you're here and continue to tell your story, whether it's a personal story or simply that this really matters to you. They want to hear this and they want to know that you care about this issue.
And the only other point I would emphasize is that often at the beginning of the meeting, there will be an opportunity to introduce yourself. Please make sure you reference where you went to high school or elementary school or what community you live in or some organization that you're part of, because that's what the congressional office is looking for. They want to know that you're involved in your community or that you're from the area. And so any type of local connections you can make, always good. And the most important thing, just to emphasize Crystal's point, is they want to know why you care about malaria. And that's more than half the battle. And Nothing But Net's staff are always able to follow up later with detailed answers on complex issues. They want to know why you care about defeating malaria. For me, when I go in and talk to congressional offices about malaria, I'll say I've had the opportunity to travel extensively, and I have seen what kind of impact malaria has on families. It pains me that moms and dads around the world can't protect their kids against malaria, but I can as a parent. And so I want to make sure that moms and dads around the world have the ability to protect their families against malaria. That's what congressional offices want to hear. Some personal story or anecdote about why you're there.
That's great.
How do we ensure that malaria is prioritized in our overall foreign affairs spending? And I think some of it is telling stories, right? Telling stories of impact, capturing people's imagination that it is possible to defeat malaria someday. I think sometimes policymakers feel that if it's a never-ending battle and we can never get to success, then it's not worth investing in. And so I think part of it, what we're doing in this summit and what we need to communicate to our policymakers is success is possible. We are achieving results. Even if there have been setbacks during COVID-19, these setbacks aren't forever. What are your thoughts on that?
I couldn't agree with you more. I think that with everything going on, the positive out of COVID is that, one, people have been staying put, particularly members of Congress and their staff. And they've had time to maybe read and listen to stories that maybe they didn't have the opportunity to do before. And participate in meetings where they get to listen to advocates from around the country tell stories, their stories of their family members, stories of their own trips and things that they've seen. We have a tremendous amount of advocates who volunteer around the world, and former Peace Corps volunteers, but even students who have studied abroad, and they see it and they're like, wow, this is something that I can make an impact on. So I think particularly with malaria, hearing those stories firsthand, I know something that the United Nations Foundation supports a lot is travel to see projects of your own or others in other countries. And I think that's important, that firsthand account. We know those stories really resonate. And when they see these stories and they see the impact that's being made on everyday families for such a little amount of money, I think it's just that it reinforces those messages. And I think hearing directly now and saying these things are still needed, even with COVID. We still need bed nets. There's still floods. There's still mosquitoes that are still happening, but we need to pick up where we left off and keep the momentum moving forward, but we still need your help. I think it's important. And I think many of those members of Congress are asking, what else do you need from us? Where can we be helpful? And I think that is not something you hear on every issue, but we're lucky on some of these issues, and particularly under global health, they're asking, where can I be helpful? What else should we be doing? And I think that's really exciting about this new Congress and about the times that we're in right now.
I agree. There's a lot of new and fresh thinking happening in Washington, and we can be part of that. And our story can be part of that broader narrative. And it's exciting to see. I think it's also important to remember that members of Congress, while they are focused on the broader political situation, which is partisan at times and still divided, they're looking for they're looking for good news, and they're looking for achievable goals, and we can be part of that story. So it's exciting to see. Crystal, I'm really appreciative that you've taken the time to be with us today, to talk to us about what's happening in Washington, and we really appreciate your leadership moving forward.
Thanks so much, Peter. Always my pleasure to speak to advocates from around the country. It's always my pleasure to advocate for more funding for global health and to advocate for those who can't speak for themselves.
Great. Thank you.
Thank you.
I want to thank Nothing But Nets for inviting me to speak for a few minutes during this Leadership Summit. and encouraging you to continue the important work as you fight against malaria. In the 21st century, even as we confront this pandemic and so many other problems around the world, we are on the verge of incredible advances in the fight against malaria, and you are playing a big part in it. Thank you for all you've done. I encourage you to continue to work hard, because I do believe that we will live to see the day when malaria, as a cause of death and suffering for so many, is wiped off the face of the earth. And it'll be in no small part thanks to the advocacy, the hard work, and the years of dedication that so many of you have put into this. So thank you, and may God bless your work. May God bless each of you.
Hi, I'm Adam Smith. I'm the congressman who represents the 9th District of the state of Washington, and I just want to offer my strong support to Nothing But Nets. They are making an enormous difference in the battle against malaria across the globe. I really appreciate their leadership and their focus. Public health is an enormous global challenge, as we are all now more aware of than we ever were before as a result of the COVID pandemic. But COVID is but one of many diseases out there that threatens the lives of people, particularly in the developing world. And malaria is one that has been around for a long time, continues to be a challenge, but we have made progress. And we've made progress because of a focus of global health organizations in general, and Nothing But Nets in particular. They have a simple, straightforward way to prevent this disease and literally save lives in so much of the world. So I really appreciate their leadership. I appreciate their work. I look forward to continuing to work with them as a member of Congress in this incredibly important effort to combat malaria worldwide. Again, thanks to Nothing But Nets for their incredible leadership.
Hello, everyone. I'm Jimmy Panetta. I'm the United States Representative for California's 20th Congressional District, located on its central coast. For the last 20 years, the United States proudly has led the fight against malaria. As a result, we've made some historic progress to alleviate the burden of this disease on families all around the world. Furthermore, the work at the Walter Reed Army Institute of Research has led to the protection from this disease for our men and women in uniform who are deployed all around the globe to protect our national security. That's why in my very first term, I introduced a resolution to recognize the Walter Reed Army Institute of Research for its leadership and its work protecting our service members from infectious diseases, including malaria. In this Congress, I plan to reintroduce H.R. 214 so that we can continue to show our support, not only for Walter Reed, but also show our support to protect the United States military personnel from malaria. See, my bill would help spark new interventions to prevent and treat malaria and enhance our efforts to ensure that malaria is eliminated and will not return. I firmly believe that when it comes to the elimination of malaria, when it comes to fighting all types of global diseases, it's the U.S. leadership that is absolutely crucial. However, you know, and I know, that it's only through your advocacy, through its laws created from legislation like mine, that we can ensure that our government, that our focus will result in nothing but net when we shoot for the basket of eliminating malaria permanently. Thanks, and I look forward to continuing to take that shot with all of you.
Hi, this is Congressman Tom Cole, the 4th District of Oklahoma. In my capacity as a past chairman and now ranking Republican member of the Appropriations Subcommittee for Labor, Health and Human Services and Education, I spent a lot of my career working on a variety of healthcare initiatives. I'm particularly proud of the effort in the last 6 years to increase funding for vital programs. We've increased funding for the National Institute of Health by 39%. We've increased funding for the Center for Disease Control by 24%. And frankly, one of the more important initiatives has been the effort to deal with malaria globally. In that area, the United States spends almost $1 billion a year now, and largely in two forms. At the Center for Global Health Security as part of the CDC, and also the President's Malaria Initiative set up by George W. Bush. Those two programs together have probably saved an estimated 7 to 8 million lives and have prevented over 1 billion to 1.5 billion cases of malaria and distributed almost 300 million nets around the world to areas of infestation. That initiative is going to continue in the years ahead and certainly has my complete support. One of the noblest things the United States can do is work with our colleagues, friends, and neighbors around the world to deal with disease. Malaria has been a killer for decades. I'm proud of the work we've done, but we haven't finished the job. I look forward to continuing to work on this critical problem in the years ahead.
I love seeing these messages of support from members of Congress, and maybe you can see it as a challenge to get your member of Congress to write similar video message and issue a statement of support around this World Malaria Day, which we'll talk to you about later. We're now going to show you this really short video, which provides a helpful overview of the U.S. budget process and why Nothing But Nets and your advocacy work is so vital. It reflects why it's so important that you meet with your elected officials around Leadership Summit, like you will tomorrow, and continue to engage and build on the relationship throughout the year to ensure that your members of Congress champion these life-saving programs. With that, let's roll the video.
The United Nations Foundation's Nothing But Nets campaign is committed to working alongside the global community towards the goal of ending malaria worldwide. Nothing But Nets champions play an instrumental role in the fight against malaria by raising awareness, funding, and voices for the importance of continued, strong U.S. leadership and funding for the UN and life-saving malaria programs. Nothing But Nets recently worked with partners to encourage the United States Congress to step up the fight against malaria, which resulted in significant increases for the President's Malaria Initiative, also known as PMI, and the Global Funds to Fight AIDS, Tuberculosis, and Malaria, also known as the Global Fund. The U.S. pledge helped secure a historic $14 billion in global commitments for the Global Fund for 2020 through 2022, which will help save 16 million lives and help end the epidemics of AIDS, tuberculosis, and malaria. Since U.S. budgets are proposed and funded by Congress on an annual basis, it is critical that champions build relationships with their members of Congress and continually communicate and meet with their offices to remind them of the critical importance of these programs. To understand the vital importance of advocacy efforts, here is a snapshot of the budget process. The government's fiscal year runs from October 1st to September 30th of the following year. The budget process begins with the President proposing their annual budget to Congress, typically by the first Monday in February. The bill then goes to Congress. Both chambers, the House of Representatives and the Senate, analyze the President's budget and draft a budget resolution. Then, a conference committee resolves the differences and presents their version of the bill. The bill then goes to the relevant appropriations committees, in this case the State Foreign Operations and Related Programs, also known as SFOPs, subcommittees, which draft their appropriation bills. The bills are then voted on and again go to a conference committee to resolve differences. Once Congress passes their final funding bill, it goes to the President for their signature or veto. If the President does not sign the bill by September 30th, the government will not have a budget for the next fiscal year, and a continuing resolution, also known as a CR, which is level funding, will go into place until a new budget is passed. For PMI and the Global Fund, the budget signed by the President determines how much of the critical life-saving work they can do. As Congress works on the budget, our champions step up the fight to ensure their elected officials know these programs are important to them. By participating in our annual Leadership Summit and stepping up the fight at home and throughout the year, champions do the vital work of making sure congressional leaders are fully aware of the importance of ending malaria for millions of people around the world. For every call made, every letter written, every fundraiser held, and every meeting with members of Congress, champions are leading the way in protecting funding for life-saving programs like the Global Fund and PMI. With funding that's a fraction of 1% of the overall U.S. federal budget, the UN, WHO, PMI, and Global Fund have been game changers in the fight against malaria. They've been major drivers of the incredible progress over the last 2 decades. 2 billion bed nets have been distributed, malaria cases have been significantly reduced, and more than 7 million lives have been saved. PMI and Global Fund support comprehensive programs including the deployment of life-saving tools such as bed nets, diagnostics, and treatment. They also train and equip health workers, improve case management and surveillance, and strengthen health systems overall. Nothing But Net's champions enable us to make a significant impact in the fight to end malaria. Thanks to our champions' awareness and fundraising efforts, we protect the most vulnerable people, children, pregnant women, and people living as refugees from malaria by providing bed nets and other life-saving tools. Thanks to our champions' advocacy, we help secure continued and increased funding for life-saving programs that have significantly decreased cases and deaths from malaria. Together with our partners, we have helped to dramatically cut malaria death rates and saved millions of lives. We've made amazing progress, but a child currently dies from malaria every 2 minutes, so there's more work to be done. This is not the time to take our foot off the gas pedal. In fact, it's time to step up the fight. Our champions will continue raising awareness, funds, and our voices to support life-saving programs until we end malaria and achieve a malaria-free world.
I'm JC Guy. I'm the Director of Global Health Advocacy here at the UN Foundation, working for Mike Beard and for Nothing But Nets. Mike?
And I'm Mike Beard, and I work for JC Guy. I spend most of my days doing advocacy on behalf of all of the UN Foundation's campaigns and initiatives. My title is the Executive Director of UN Foundation Advocacy. I've spent most of my days talking to you about malaria, as well as spend a lot of time on the World Health Organization.
So we're here today to talk to you guys about Congress. Mike and I, in our former lives, both worked on Capitol Hill. We worked in the Better Chamber, which is the House of Representatives, of course. And we're really excited to give you a peek into our world and to the things that we do every single day, because you will be doing them in just a short amount of time. So Mike, you want to give us a scene setter? Where are we in Washington? We have a new administration, a new Congress. What's going on?
You were probably one of the last groups here in Washington before everything shut down. And so to say that everything has changed would be an understatement. As everybody knows, November happened, a new Congress was elected, a new administration was elected. One of the hallmarks of the Trump administration was to shake things up and changing up how we do foreign policy. The Biden team is actually a little bit of a return to normal, but more about trying to put in people who have the experience, who know how to get things done. People who have been in the trenches, who have been able to enact policy, who have thought big about malaria and foreign policy. In the last 3 months, we have the confirmations of Secretary of State Tony Blinken, who was the Deputy Secretary of State during the Obama administration. We have Linda Thomas Greenfield, who was the Assistant Secretary of State for the Africa Bureau, who is now our new U.S. Ambassador to the UN. The former U.S. Ambassador to the UN, Samantha Power, is now going to be over at USAID running our development and humanitarian response programs. And then I think more than anything, as we look at all of the personnel decisions that have been made, the Biden-Harris team are putting a particular focus on returning to our allies and trying to restore the ties that we've had since World War II. So the reinvigoration of the World Health Organization, the focus on supporting for the Global Fund, and it's really interesting. And I think we'll see this played out a lot over the next 3 to 4 years. This idea that a return to normalcy isn't actually, it needs to go farther because we have new challenges here in the United States, but also around the world that we have not really even faced before. So I think it's a return to normalcy with an asterisk. I don't know. What do you think when you've thought about this last year, especially these last 3 months, JC?
I'm really excited for a return to boring, to be very frank. I'm excited to not wake up in a panic. I'm excited to have a little bit of process and structure come back into play. Once you work on the Hill, that's what you live and breathe for is rules and someone telling you what's supposed to happen at all states of the game. And as you laid out, Mike, the entire kind of team coming into DC is going to be one to watch, absolutely, especially as we refocus our efforts in foreign policy. So I'm going to touch really quickly before we get into some more interesting stuff, just on some basics here. What's Congress? Like, where are we going? What is happening? So our quick and easy guide to Congress. There are two chambers within the Congress. We have the Senate and the House of Representatives. The Senate is designated with 2 senators per state. As per the Constitution, you have 100 senators. Then we have 435 members of Congress, or in the House of Representatives. There are currently 5 seats vacant in the House, so technically only 430 members are there right now. The senators get to serve for 6 years once elected, and the House members only get to serve for 2, which is one of the reasons why Mike and I think the House is so much fun. There's always something happening, always things going on, and we don't have as many rules to remember as the Senate. And obviously, the main reason we want to talk to you about that today is because Congress has the paramount power granted by the Constitution, and that is to legislate. So in Article 1 of the Constitution, it gives this awesome power to the Congress. And that's where you guys come in, which is really awesome because Congress has to listen to y'all. And that's exactly what you'll be reminding of them in a very polite way tomorrow when you go to Capitol Hill virtually. Congress, though, just to feed more a little into where Washington is at the moment, Congress is probably the most narrowly divided that we've seen in a very long time, certainly since I worked on the Hill and maybe even since before Mike was on the Hill decades ago. Democrats have a majority of only 8 seats in the House, and there is a tie-breaking vote by the president of the Senate, which is the vice president of the United States, because there was a 50-50 split in the Senate. And it took weeks to come up with a power sharing agreement between the Republicans and Democrats on the Senate side. Mike, do you remember a time where Capitol Hill was this contentious, perhaps in our recent memory? And can you talk a little bit about how these narrow margins might impact the work that we do?
I think your point is incredibly important, JC, about it being so narrowly divided. I will say that there is hope. It's not always that they are going to be overly contentious. I do think that this narrowly split Congress is going to actually mean a lot of work that needs to be done in terms of trying to find common ground on pieces of legislation. I think first off, the narrow split between the House and the Senate, and within the House and Senate, probably means that the fiscal conservatism that Republicans and even a lot of blue dog Democrats preach is going to come back with abandon. We've had 2 major stimulus packages. $1.9 trillion is no laughing matter. And even before that, the earlier CARES package that approached $1 trillion. That's a lot of money that they are spending right now, with some of it on foreign assistance, and we can talk about that more later. But so I think there will be an effort to rein in federal spending at some points. Back in 2011, the House and Senate and President Obama and Vice President Biden agreed to certain spending caps per each year. And if you could not break the spending caps, we are outside of the spending caps this year. But I think that also means that there is likely to be maybe a bigger deal on these, on trying to rein in federal spending a little bit. We as global health advocates, we have actually been pushing for more spending on foreign assistance. And I think, JC, you can explain why. But and because federal spending on foreign assistance is so small, it wouldn't affect us. But I think overall, like the fact that there are no spending caps is, I think, a good and a bad thing for what's going to happen this year and probably even next year on appropriations. So JC, we just talked a lot about some wonky stuff, or at least I have, and I apologize to everybody who needs to hear me dribble on through wonky issues like sequestration and spending caps. But it's been a year. and we recognize it's been a year. What have you seen in terms of like your meetings with the Hill lately? Like how has it been going? What is normal looking like right now?
That's a great question. I think that normal is looking a lot like this. Normal is looking like Zoom, and I think everyone's a little tired. But I think that we have a really interesting moment here that we probably haven't had in a while. The attention span of the Hill is very short. So something happens, they focus on it, and they move right on to the next big flashy thing that is going to take up your news cycle for the next 24 hours. Probably the last time that we saw something in global health catch the attention of Congress would probably be maybe the Zika crisis, but before that, Ebola. And we haven't really had a moment that's really captured the attention of Capitol Hill like COVID-19. And honestly, it's because COVID-19 has brought just how devastating an infectious disease can be on a family to each and every American. And that includes Capitol Hill, members of Congress, their staff, their families, their friends. So every staffer, from the staff assistant all the way up to the chief of staff and to the member themselves for the last year, has been pretty similar, like solely focused on COVID-19 response, on getting their constituents the things that they need and what that critical care actually entails. But I do think that there's this new common ground with global health, because now everyone knows what it means to keep their children home from school. Now everyone knows what it means to go months or years without seeing a loved one or hugging one of your friends. Everybody now understands the reality of having to leave your job because of a threat to your safety or the health of your family. So we've essentially experienced what families in malaria endemic countries experience every single day. This is a moment to really connect that idea or that reality in these meetings. It's not just going to connect now with those staff who've traveled with us, who've gone out into the field, who've slept under a bed net, who've taken an anti-malarial medication. This is going to be able to land really well with staff who maybe haven't set foot out of this country and don't know anything about malaria. And I think that's really important to remember, that we've all lived a common experience for the last year. That is an experience that so many around the world have to live every single day. We still have to somehow break through because there are so many different things that are trying to grab congressional attention in this moment in time. Mike, how do we do that?
For the last 10 years, Nothing But Nets has been always up on Capitol Hill, always knocking on doors, always building a relationship. Because right now, even in the time of Zoom, even in the time of digital everything, real connections are important. So you as champions, you out there as champions are so vital to this cause, because members of Congress, as JC said, have very short attention spans, and their staffs are overwhelmed with everything that's going on. They are working from home just like us. They are at the other end of a computer screen. You building that relationship has been so vital. The way in which JC, you and I have taken the time to meet with staff, have taken them on trips, and how we have tried to use social media and op-eds and everything else to just keep the attention on. It's the drumbeat. The drumbeat is so vital. And I think that it's really important that we continue to have these moments to remind members of Congress and their staff how vital it is that we end malaria.
I think it's critical that our grassroots champions continue to keep up that drumbeat, because members of Congress want to hear from their constituents. They want to know that what they're doing is something that your community values. So let's tie that a little bit right there. When you're in your meetings, talking about why malaria matters to your community is one of the most important things you can do. You could think about it like an elevator pitch. So I'll give you two really fast. My name's JC Guy. I am from Columbus, Ohio, and malaria matters to me for two big reasons. The first, I'm an Army brat. Columbus has a huge veteran population, and It is very hard to find a member of the military who has not come into contact with malaria while deployed overseas, especially those who are like my dad and are the Vietnam era. The second really important reason, and this is what I would tell my member of Congress, I'm a new mom to the greatest little boy, and Mike is a new dad to the funniest little girl. And we are so lucky as new parents in Washington, D.C., or if I was referencing Columbus, Ohio, that we get to go to bed without worrying about our child dying from a simple thing like a mosquito bite. And there are millions of new moms and dads around the world who don't get that same kind of security and safety when they go to bed at night. So that's why it should matter. We should try to be protecting these families all around the world that are just like us, who are fighting this treatable and preventable disease every single day. So now I am going to make us switch to something, and I promise it's our last wonky thing before we get into what does your meeting look like. We're actually going to talk a little bit about the congressional calendar really quickly, and then we're going to go into what you're actually asking for from Congress. So Mike, kick us off here. Where are we?
Congress must approve a budget we are going into fiscal year 22 by September 30th of this year. That's when fiscal year 21 ends. So fiscal year 22 starts, and a lot is going to happen between now and then.
Our efforts as you support the President's Malaria Initiative, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, as well as support funding for Centers for Disease Control and Prevention, which is CDC, the Department of Defense and their malaria funding, and of course, our UN partners and agency partners. So we'll show you a little graph here that shows where malaria funding comes from all over the world. So you can see that a big chunk comes from the United States, but a really big chunk also comes from endemic countries themselves. It also comes from private organizations you can see on there. And then our multilateral institutions, just our multilateral programs like the Global Fund to Fight AIDS, TB, and Malaria. Your funding ask this year focuses just on two things. The first is that we are supportive of stable or level funding for the Global Fund to Fight AIDS, Tuberculosis, and Malaria. The second thing we are asking for is for an increase for the President's Malaria Initiative. This is really important, and we've broken it down into just 3 key points that we'd like you to make during your meetings. Don't worry, all of this is written down in a script for you to follow point by point, word by word for your meetings on Tuesday. The first reason that we think PMI, President's Malaria Initiative, needs an increase is to buy more things like bed nets. They need newer nets that are more effective at fighting against insecticide resistance. The second thing is that PMI needs more funding so that they can train and equip more community health workers to reach more people.
And lastly, we would like PMI to be able to address increases in manufacturing and freight costs for malaria commodities due to global supply chain disruptions caused by COVID-19.
That's your ask. And again, all of this will be really clearly written out for you. I'm not expecting anyone to memorize this right now. So Mike, let's go into something more fun. You and I have been in hundreds of meetings as congressional staff, and probably hundreds more at this point as advocates working for the UN Foundation. What are some of the most surprising things that you've experienced, not only as a staffer, but also on the other side?
So the staffers are generally young. They also have a ton of issues that they have to follow. I remember, and JC, you probably had this as well, you had probably 5 or 6 different issue areas ranging from like small business to veterans affairs to foreign assistance and tax policy. And you're just barely keeping your head above water. Usually they're a mile wide and an inch deep, and most staff can say 1 or 2 small little things about every issue, but they probably don't know a whole lot about it. That's actually a good thing for you, because you don't need to be at all intimidated by them. They are going to listen to you, and they want to listen to you.
We want to keep reminding you of is these folks are here to work with you and are excited to meet you, but please don't be intimidated by them. What are some of your do's in a Hill meeting, Mike?
I think especially on the Hill, we have to leave our politics at home. What we do in these meetings we're advocating on an issue, whether you voted for, were a supporter of your local congressman or not, or congresswoman, it doesn't matter to them. They are there to represent you. So we leave our politics at home. What I have found over this last year, it's very helpful for staff to get some of that time back. But it's also, I think, more effective for you as advocates to be to the point, to be succinct, to put our best foot forward, really. So you're shooting for 15 to 20-minute meetings. There are a ton of reasons why a member of Congress should support ending malaria. But why does it matter in El Centro, California, in Columbus, Ohio, in Bethesda, Maryland? Make the case. It does matter to your community, and it needs to matter to these members of Congress for them to be supportive.
And I think we've touched just a little bit on that before, but really tying it back to your community is going to be one of the most effective things, more than the numbers, more than the percentages, more with how effective these programs are. It's why it matters to you, and it's why it matters to your community is really the point we'd love you to focus on tomorrow. And I do how you said that, Mike, to leave your politics at home. You guys might not know, but Mike and I come from offices that were on opposite sides of the political spectrum, and we tolerate each other totally fine. So we want to make sure that when you go into an office, you're respectful and truly to leave your own political affiliation at home. We're there to be a bipartisan, positive, really easy, really happy meeting for them. Tying it back to one of your previous points too, Mike, is to when you're keeping these meetings to your 15 to 20 minute kind of window, make sure that you're making your asks very clearly. And that might mean you have to practice them a couple of times. We're giving you kind of the information prior. We know that Wendy and Amma have trained you really well to be able to do that. So make sure that you practice tonight. Read your script. It's there for you for a reason. It's there to help you, and it's there to really guide you all throughout the day tomorrow. So with those great positive things, Mike, give us a couple of don'ts, and then we're going to wrap this up and stop talking. We promise.
I think my biggest thing that I said right off the bat, don't be intimidated. These staff are here to help you. They are here to represent you and your area. So just talk to them like everybody else that you meet at the grocery store. Don't answer questions that you don't know the answer to, or you don't feel comfortable answering. JC and I are here, and you can always refer back to JC or I that we could follow up later to answer those questions. What about you? What are your don'ts, JC?
I think one of my favorites is to not forget your thank you note. The entire point of this whole experience, virtually or otherwise, is to make that connection with the congressional office. We're trying to bridge the gap or foster this relationship between you and your member of Congress or the congressional staff. We know it works. We know that there are long-lasting relationships that have come out of meetings just like these. I can shout out to a couple of you champions that I know keep up with your members of Congress, and is awesome. We really want you to be someone that in the future they think of when they're hosting an event in district, when maybe something has happened in the global health space and you're like, wait, I know that this could connect to malaria. Maybe I should reach out to those folks at NBN. And that's really the whole part of this day, is to make those connections. And it's going to help in the long run. It's going to help you not only get your foot in the door once, but maybe you start going back for other things and you start getting involved more and more with the office, or you just start lifting up the good work of NBN more often. And that's exactly what we're trying to do, is make those connections.
Thank you all for joining us. Thank you for doing this. This is going to be a great next day. So we really appreciate your attention to this, and have a great one.
Hi, it's Congressman Jamie Raskin from Maryland's 8th District. I just want to send my warmest possible greetings to all my friends at Nothing But Nets, your leadership summit. Please keep up your fantastic, outstanding work. My district is directly involved in it because of the Walter Reed Research Institute, which has been doing a lot of research on malaria. But we've got to wipe out malaria, and I want to thank you for your perseverance and your resiliency and your mental toughness. We must get this done. Thank you for all of the great progress that's been made, and let's go all the way and wipe out malaria so we don't have any other avoidable deaths from this dread disease. Thanks so much, and have a great conference.
Hi, everybody. I'm Congresswoman Betty McCollum, representing the families of Minnesota's 4th Congressional District. Thank you for your work to put an end to malaria. Ending malaria is an issue I am passionate about, having had the opportunity to travel to Africa to launch President Bush's malaria initiative focusing on bed nets. I know how devastating this disease can be, especially for pregnant women and children. Effective U.S. investments are saving lives. For over the last 20 years, millions of lives have been saved thanks to targeted interventions. There's work to do, especially in sub-Saharan Africa. The U.S. is the largest donor to the global malaria efforts, helping to lead this fight for decades, and we're not going to stop until the job's done. As the chair of the Defense Appropriations Subcommittee, I have the opportunity to continue to defeat malaria. Once the COVID-19 pandemic has passed, malaria will be the #1 infectious disease to treat for our military service members. The research that's being done at Walter Reed National Military Medical Center will not only help protect our troops, but it can be adapted to fit the needs of vulnerable populations around the world to save more lives from this terrible but yet preventable disease. I have fought to preserve the U.S. military's malaria research funding, and I'm going to continue to do so. We need to use every tool at our disposal and ensure that we are making investments in malaria, and that's the only way we're going to be able to defeat this disease. So I want to thank you all once again for your dedication to this cause. It's more important than ever that leaders like you are fighting for a safer, healthier, malaria-free world. Thank you.
Hey everyone, Brian Fitzpatrick here, and I would like to give a big shout out to the many Nothing But Nets champions for your dedication and tireless efforts for this important cause, especially throughout this unprecedented past year. Every 2 minutes, somewhere in the world, a child dies from malaria. And while we have made tremendous progress over the last 20 years in the fight to end this awful disease, we have much work to do. And with continued U.S. leadership, the support of the American public, and your continued incredible service and advocacy, we can see that fight through to the end. And I applaud and thank each and every one of you. God bless, and let's end malaria.
Wendy.
Hey, Alma.
Despite a challenging year, our Nothing But Nets champions have continued to set the standard of excellence as leaders in the fight to end malaria. This year, champions hit a record coverage of 41 states in the U.S., the most representation we've ever had at a single leadership summit. Our longtime advocacy partner, Junior Chambers International, also hit a new summit milestone this year with coverage in over 21 states. This year's virtual platform has also allowed us to engage the global malaria community as never before. We're excited for new opportunities to engage new champions and international guests, streaming the summit live in 27 countries, from Brazil to Nigeria to the Netherlands. Our champions come from all walks of life, and that's never been more evident than this year. Whether you're a malaria survivor, healthcare worker, or just a student in a small town trying to do a good deed, each of your stories together sends a message, loud and clear, that malaria matters to everyday citizens.
The broad net of our champions builds a great strength. As Alma mentioned, the fact that we can count on supporters from all walks of life and experiences demonstrates the range of community support that we can count on. This is also the case in the halls of Congress. Because of the unifying nature and agreement surrounding malaria elimination, we are thankful to count on supporters from both sides of the aisle. As a campaign, we can actually bring members of Congress together with the common purpose of ending malaria. As champions, you're part of that legacy. Champions are leaders in the global effort to end malaria. Our members of Congress look forward to connecting with you, and it's critical that we maintain and cultivate these relationships. As you know from your personal friendships, being a friend requires being present and being reliable. So although we can count on the support of members of Congress, it's your presence that makes the difference. And that's the beauty of the American system, that people have direct access to your leaders, and you can schedule a meeting, you can make a phone call, you can continue to make your presence known, reminding your members of Congress to invest in programs like the President's Malaria Initiative, the Global Fund to fight AIDS, tuberculosis, malaria, and UN agencies like UNICEF to help alleviate the burden of malaria. That's why your presence and your voice is so important, because it will lead us closer to achieving malaria elimination.
Thanks to bipartisan U.S. leadership, we have seen significant progress towards the eradication of malaria over the last 2 decades. Global deaths have dropped by 60%, with 1.5 billion malaria cases averted and 7.6 million lives saved. Your advocacy enables PMI, the Global Fund, and our numerous international partners to provide cost-effective tools like insecticide-treated bed nets, rapid diagnostic tests, and anti-malarial treatments to at-risk communities. This work is made possible by the tireless effort of our champions. Just this year, we witnessed a landmark achievement in the fight against malaria when El Salvador was certified as malaria-free. This took years of collaboration between multilateral organizations, national governments, and community healthcare workers. But we cannot understate the importance of your role as advocates in reaching this triumph. We are honored to be able to share these victories with you, the people who made it possible, our champions.
These wins are your wins. These achievements were reached because people like you attended Summit, met with members of Congress, and then went home and did it all over again. In the spring for World Malaria Day, in summertime for World Mosquito Day, and in the fall for Malaria Day in the Americas. Champions throughout the year continue to stay engaged in different ways. Whatever time you have to give, we have an advocacy action that fits your schedule. If that's a meeting with your member of Congress, signing petitions, making calls, we have it. Just know that you have a whole team behind you, walking you through the process, so you don't have to figure this out alone.
That's right. Nothing But Nets team is here to serve as a resource to you on your journey to be the best advocates, leaders, and storytellers you can be. Once again, thank you.
Thank you, champions. Hey, champions, welcome back. During our time together, we will be sharing how you can be doing more as an advocate for ending malaria beyond Summit.
That's right, Wendy. One of the programs we advocate for is PMI, the President's Malaria Initiative. The money goes directly through the U.S. government to programs on the ground in countries around the world, helping in the fight to end malaria.
Thanks for sharing that, Alma. And that just continues to remind us that raising our voices matters, that your involvement and your advocacy is critical to ensuring that the numbers we see reflected in statistics, our people, our stories, our lives. It's easy for us to just boil it down to numbers, but these stories that we've heard are great reminders that advocacy leads to real change. that we can engage members of Congress in in-district meetings at Capitol Hill by making phone calls or signing a petition. Each of these actions reminds our leaders to continue the fight to end malaria.
Through your voices, we can lead the way to do our part and ensure that critical life-saving programs, including the President's Malaria Initiative and the Global Fund to fight AIDS, tuberculosis, and malaria, have the resources they need to eliminate malaria for good.
So how can you be a part of this? Easy. By being here today, you're a part of it right now. We invite you to continue to stay plugged in throughout the year as we continue to cultivate our relationships with our members of Congress during World Malaria Day, World Mosquito Day, and Malaria Day in the Americas. As we've mentioned earlier, we have an advocacy action that fits every schedule.
Plus, when you take action with Nothing But Nets, you get the opportunity to earn points and qualify for exclusive opportunities. In order to earn these points, we need to know what you're doing. That's why we've developed the STAR Tracker system. It's a quick way for you to tell us the amazing work you're doing with Nothing But Nets and talk about the points that you are earning for advocacy. So on your screen now, you'll see our chart. It lists all the different engagements you can take as a Nothing But Nets champion, how many times each year we expect you to do them, and the point value. When you go to nothingbutnets.net, you'll be able to find the STAR Tracker, plug in your points, and tell us all the great work you're doing. Make sure you take a screenshot or a photo at the end of each engagement.
So something that we'll have the opportunity to do together today is make a call to our members of Congress. By doing this, you're amplifying the voices of our champions and driving the level of urgency that your fellow champions will echo in their meetings tomorrow.
If you're feeling a little bit nervous about making your calls, don't. We've made it super easy for you.
If you're joining us from the US, you will have the opportunity to include your voice in the efforts of our champions by calling your members of Congress today. All you'll need is your cell phone. Then you're going to text NBN21 to 30644. It's not case sensitive, so just like sending a regular text message, enter 30644 in the recipient field and type NBN21 in the message field and hit send.
Once you've sent the message, you'll receive another message with a link to a script. You'll use that script to go through it and read for your members with your senators and your House reps.
Please note that there are two versions of the script. One is if you're connected to an office staffer, so if you're speaking to a person, and the other is if you're leaving a voicemail.
When you click on the number embedded in your message, you'll hear a message from our team, thanking you for taking action and letting you know that you will be connected to the Capitol switchboard where your call will be directed. The operator could be a person or it could be automated. If you speak with a person, then you'll need to know which office you're calling. You can go to GovTrack to find out who your representatives and senators are if you don't already know. If it's an automated message, just follow the instructions to make your call.
In a minute, we're taking questions, so get ready, enter your questions on the chat, and we're going to answer them live. Remember that when you're completing your calls, you'll need to hang up and click on the number embedded in the text message each time you call. So for example, after completing your call with your House rep, you would hang up and click on the number again and call for your senators.
Also, we want to make sure that you're earning points for these awesome actions. So take a screenshot of your call and include that in your STAR report. We'll receive a text from you and we'll be able to let you know, prompting you to complete the report at the end of your call.
Thanks, Alma. We don't want to miss out on those points. So make sure you're reporting your actions. In total, completing all 3 calls should take about 5 minutes. So let's get started. So we're going to pull out our cell phones here. Going to open the message field. I'm going to do this, okay, guys? But if you have any questions, just enter it into the chat. We're here. We're answering them. We're with you. We're cheering you on. Yep. And I'm doing this too. So go ahead, enter your message field. Type 30644. And you're going to text NBN21.
And again, don't feel nervous about talking to this person on the other line. We've made it super simple. You've got a script that'll break down all the talking points that you'll need. Feel comfortable, feel confident, and remember why you're here with Nothing But Nets.
So I got my auto response message. I'm going to click on the script. So that's open and ready for when I call my member and I know exactly what I'm going to say. And now I'm going to go back to the message and I'm going to click on the phone number. And then I'll hear my message to you guys now. I hope you're doing this with me. Remember to enter your questions in the chat.
Hey champions, it's Wendy from Nothing But Nets. Thank you for taking 2 minutes of your time.
So Wendy's on her way to make her call now. Let's see how many of you can make your calls during this time. So we have a message coming in. We have one question coming in from Patrick. So how do we avoid being nervous during these meetings? Well, keep in mind, you're never doing this alone, right? Not only do you have myself and Wendy, you've got a massive network of champions right beside you, supporting you, rooting for you. And the members of Congress are actually really excited to hear from you. They want to know that their constituents care about issues like global health. And so you never have to feel nervous. It can be a little daunting for the first time, but once you get into it, it just picks up. You feel the courage behind you and your wings go into the air.
And being connected to the switchboard. It's ringing. I hope yours is ringing too.
And keep in mind, for those doing this kind of advocacy for the first time, this is exactly why you have your script. Sometimes it can be nerve-wracking to talk freely, I know for sure. But if you have a script, it gives you a really nice guide of what to say, keeps you on track. We never want to just chat up the members of Congress. We want to be concise with our messaging, and that's where the script comes in handy.
I got the operator, guys.
So Wendy has an operator now. We're going to see what that looks like to complete a message that's automated. And again, if you have questions, feel free to drop them in the chat box. Our team is monitoring it, so we'll have it for you.
I'm going to leave a voicemail, guys.
So we're going to hear Wendy on speaker leaving a voicemail.
Hi, my name is Wendy Dimas. I'm representing Nothing But Nets. I'm part of the campaign here. I'm from Hollywood, California. I'm a Nothing But Nets champion and just wanting to leave a voicemail. Today I'm calling to thank a member of Congress for bipartisan support in the fight to end malaria. As Congress continues consideration for fiscal year 22 appropriations, please support robust funding for PMI and the Global Fund. We're seeking flat funding for the Global Fund at $1.56 billion, which is the line with the 3-year commitment in the U.S. Congress made around the Global Fund Replenishment Conference in 2019. We're also seeking to increase PMI for $770 million to $902.5 million. Also, with World Malaria Day quickly approaching on April 25th, we would greatly appreciate a sign of support from your office through the social media posts. Thank you for your time and your service to our community.
That was perfect. She hit all the talking points. She introduced herself. She was kind, courteous, and concise. That was a fantastic voicemail. So champions, we hope you took this opportunity to engage and participate. Now for our friends around the world, we have an action for you to take as well. Text DRAW21, that's D-R-A-W, the numbers 21, to 30644. Again, that's 30644. It's not case sensitive, so just like sending a regular text. Enter 30644 to your send field and type the message DRAW21 in the message field, and then hit send.
Once you've sent your message, click on the link and raise your voice by selecting one of the social media images for you to share on your channels.
Social media posts are a great way of building awareness in your community because they let people around you know that you're committed to the fight to end malaria. And it keeps the issue accessible and at the forefront. If you have any questions, again, take this opportunity to post them in the chat. We'll be here to walk you through the process.
Thank you for joining us these past few days. We do not take it lightly that you've chosen to partner with us as we each do our part to end one of history's deadliest disease. We're getting closer, but we need each one of you to take us over the finish line.
Absolutely. So remember, follow us on social media. It's a great way to stay engaged and up to date with our announcements. Follow us on Twitter at NothingButNets, Instagram at NothingButNetsOfficial, and if you're not already receiving our text messages, go ahead and text the word malaria, that's malaria, M-A-L-A-R-I-A, to 30644 to sign up for our automated action alerts. Thank you so much for participating. It's been great having you with Nothing But Nets.
Bye, champions.
Thanks again.